In an effort to increase the value and the attendance of the quarterly medical staff meeting, Carolinas Healthcare System Blue Ridge is working to ensure that these meetings demonstrate a clear benefit and purpose for physicians. Medical Staff President Dr. Brian Cox explains.
I think Medical Staff Services has realized, along with the medical staff officers, that attendance to our quarterly staff meetings might be lower than expected. Physicians do want to feel like they're using their time wisely and that they have opportunities and meetings like that to do so. But I think we felt like physicians and advanced care practitioners didn't have the opportunity at these particular meetings to give that feedback, to give input, to be a part of the meeting. And so we have looked at ways to make changes. We've sent out a survey to our medical staff, and based on that survey and those results, we've tried to make some changes this year to our quarterly staff meeting.
Dr. Cox says two of the changes that have been instituted have already boosted physician attendance.
The first one was our patient story. We wanted to really encourage physicians to be a part of that, to share a case or a physician story or something that would touch the audience and let everybody know what we're doing here as the Blue Ridge family. The second thing we're doing, which is new and I thought very informative at our last meeting, was a service line highlight, which again could be a case presentation or just an informative session on something that's new in the medical literature, or even more specifically, what are we doing here at Blue Ridge? And so Doctors Bauer and Smith did a presentation on cryoablation of renal tumors, which I thought was very informative, and probably a lot of the audience didn't even know that we offered that service here, and that was a great success story that was presented.
Meetings among physicians are becoming more and more important as tools for education and the exchange of ideas, as well as forums for organizational updates.
It's a business meeting for the most part, but it needs to be informative so that clinically everyone's on board and knows what's going on here, and also with administration they have an opportunity to present and provide information that might not otherwise get out to the medical staff. So as we have this new format and we try to switch things up a little bit, we would definitely appreciate feedback from the medical staff ongoing about how things are going and if we can make any other changes to encourage attendance and participation.